Good afternoon. We've had some reporters down at the O2 and Chessington following the excellent good news announcement by your colleague, the Health Secretary this week, that 100,000 tests a day will be carried out later in the year. And we found lots of problems with bureaucracy, people turning up and leaving untested. NHS nurses are in tears because they're told they need an email or they need identity or an appointment. What can you do to cut through this red tape? Because there's no point in bringing in extra tests if people can't be tested in the system that's in place. And if I may throw in a quick one too, we've heard today of 5G masts being burned down by people who have read false rumours on social media that these masts are in some way responsible for spreading the virus. Can you please debunk that myth for us, please, and explain what damage these people are doing to communication at a very difficult time for this country?
Thank you very much, David. On the first point, I'm very grateful to Boots and to others who've played a role in making sure that we can have drive-through testing in Chessington, in the O2 Centre, and in other sites. It is there specifically for NHS workers, and the aim was to make sure that only NHS workers had access to it. But if it's, as your reporters have discovered, being enforced in a bureaucratic fashion, then I will talk to Matt immediately after this press conference, and we'll make sure, working with the Boots team and others, that those who need those tests get those tests. And thank you for that reporting, because it's precisely that sort of investigative work that makes sure that we can, when we encounter problems and bureaucracy, try to cut through the red tape. So we will do that, and we will report back tomorrow or at Monday's press conference any progress that we've made. On the point about the 5G masts, thank you again for mentioning. The story somehow got about that they play a role in the spread of the disease. That's just nonsense, dangerous nonsense as well. And I'll hand over to Steve to say a little bit more about the vital importance of knocking down this rubbish. Yes.
So the 5G story is complete and utter rubbish. It's nonsense. It's the worst kind of fake news. The reality is that the mobile phone networks are absolutely critical to all of us, particularly in a time when we are asking people to stay at home and to not see relatives and friends. But in particular, those are also the phone networks that are used by our emergency services and our health workers. And I'm absolutely outraged, absolutely disgusted that people would be taking action against the very infrastructure that we need to respond to this health emergency. It is absolute and utter rubbish, and I can't condemn it in stronger terms than that. On the testing, the good news is we said that we would ramp up staff testing. We're actually testing staff not just through those drive-through places that you've seen, or those drive-through facilities, but also in spare capacity in our NHS laboratories as well. And I'm pleased to say that yesterday we tested over 2,000 NHS staff in the capacity we had in our NHS laboratories. That's 16% rise on the day before, 34% on the day before that, and the latest data shows over 4,000 staff have been tested in those drive-through facilities. So we are increasing staff testing all the time, which is really important, so that where staff or their household members don't have coronavirus, they can come back to work and assist with the pressure that is clearly building on the NHS at the moment.
Thank you, Steve. Anything more that you wanted to ask, David?
No, that's fine. You've covered my points well. Thank you.
Thank you very much, David. Thank you. And we'll turn to David Maddox of the Sunday Express now.
Good afternoon. To begin with, could you give us any indication as to why the numbers of infection rates appear to have jumped up so quickly in the Midlands and the North East and Yorkshire? Also, a question for Michael Gove. On the help for people, the self-employed in particular, is there any possibility that this could be reviewed, given that people who have company directorships, who often don't get much money from those company directorships, are now blocked from having any of that help? And finally, in terms of exit strategy, and sorry to use that term, Professor Paris, but do you have an infection rate in mind as to when the lockdown measures, social distancing measures, maybe scaled back?
Thank you, David. I'll take the second question and hand the first and the third over to Steve. The package that we put in place in order to support the self-employed and also to support workers and the economy overall has been designed in order to help those principally on lower incomes in order to help them through a difficult time. It's been designed specifically targeted in order to do that. But as we've seen in the course of this week, the Treasury are keeping these schemes under review and are doing everything they can, working with the banks and others, in order to help support viable businesses, to keep people in employment, and to put the government's hands around every working person. So if there are specific examples of inefficiencies in the way in which the business support scheme or support for the self-employed is operating, then I know that the Treasury will want to look at them in order to make sure that support is targeted as effectively as possible. But I'll hand over to Steve on the question about the regional spread and also about how we manage our way out of the current situation.
So on the geographical variation, I think it's difficult to give a particular explanation as to why any particular part of the country has a higher rate at any one time. I would say that perhaps, not unsurprisingly, London as a major urban centre has an infection rate which is maybe a week or so ahead of the rest of the country. But for instance, if you look at a normal winter and look at the spread of flu in a normal winter, it's not unusual to see flu rates in the winter pop up in one area of the country before they rise in another area. So that geographical variation is actually to be expected. Although, as I say, it's difficult to get under the skin of why one particular area versus another might have a higher rate at any particular time. So not unexpected. On the infection rate per se, no, I don't have a particular figure for infection rate. And I think it allows me to highlight one of the bits of scientific information, one of the pieces of the jigsaw that I've been talking about earlier, that we don't know about yet, but which will help us when we develop strategies going forward. So we are still not clear how many people might have had this virus but have not developed symptoms. That is work that's going on internationally, and in fact it's work that's going on in this country as I speak to try and understand what that figure is. When that information becomes available, when that scientific knowledge is known with large numbers of people, that will help us not only in our strategy going forward, but in our understanding of infection rates per se.
Thanks very much. Is there anything you just wanted clarity on there, David?
No, just very quickly then, are you putting more weight on infection rates or hospital admissions in terms of your strategy going forward?
Well, I think the strategy has been quite clear, and it continues to be the strategy. The strategy is to save lives and to protect the NHS. Save lives because clearly we wish to save lives. As a doctor, that's why I went into medicine. Of course, we need to save lives. But putting less pressure on the NHS is important for a number of reasons. Firstly, as I've said before, our strategy is to build capacity in the NHS. So at the same time as we are reducing the spread of the virus by the measures that the government have put in place and that we all must follow, so reducing demand, we have worked hard to make sure that we're ahead of the curve, and we have increased capacity. And you've heard about the Nightingale Hospital and more Nightingale hospitals today. So we still have capacity within the NHS. Even in London, we are ahead of this surge. And I think that's down to the huge efforts that the NHS has put in. So going forward, the strategy will need to be to continue to make sure that the NHS can cope with this and that we save lives. So those are the two pillars of the strategy going forward.
Thank you. And we'll turn now to Michael Savage from The Observer. Michael.
Thank you. First to the Secretary of State. On compliance, you mentioned in your introduction about young people using social media to reach them. Do you have demographic data suggesting they're being less compliant at the moment compared to other demographic groups? And also, we're 2 weeks into this now, you're having to work very, very hard to implore the public to stay home. What other methods could the government call upon when we're months into this rather than weeks to ensure compliance continues? And to Professor Powis, if I could, question on ventilation. Neil Ferguson says we might reach a peak in 7 to 10 days. According to our models, how many ventilators will we need at that point? and how many do we think we will have? Thank you.
Thank you very much, Michael. The evidence does suggest that compliance does vary across different sections of the population, and there has been evidence to suggest that for some young people there's been a lower level of compliance, and that's why it's important that we reach them appropriately. It may be that some of the messages and some of the channels that we've used have not reached some sections of the population. It may be that younger people feel that they're less likely to be affected and less likely to be infected. One of the reasons, therefore, for trying to make sure that our message is consistent is that for some, you may hear this message again and again and again and think, well, the government is, as Steve mentioned earlier, sounding like a cracked record. But there'll be many who won't have access or don't access traditional media, and we need to make sure that we get the message through to them. The evidence is that people appreciate why it's important. People appreciate the ethical reasons why self-restraint can help others at a time like this, and it's because people are building up that broad social understanding that I'm confident that we can work with the British people to ensure that over the weeks, for as long as it takes, that we exercise the self-discipline required in order to beat this virus. But you are right in the implication of your question. It is tough. And I particularly appreciate that it is tough for families, it is tough for those in economically vulnerable positions, and that's why the government is always looking at ways in which we can help those by making sure that we're alive to the pressures that they face. I'll hand over to Steve on ventilator capacity, but one of the things I would say, as I emphasised here, is that the more that people observe the social distancing guidelines, the more time we buy the NHS, and the more ventilator capacity, non-invasive and invasive, we can secure, and that has to be our aim.
Yes, so that's exactly right. And as I said in answer to the previous question, the NHS strategy has been to constantly build capacity so that we stay ahead of the demand. As Michael has said, we need to reduce the demand. We're doing that through social distancing and staying at home, but we have planned over the last few months to stay ahead of capacity. So I won't give you a number in terms of our aim for ventilators, but I will say that we are constantly looking to procure ventilators, and the call to arms for British industry is also aiding in getting ventilators from sources that we didn't have before. And Michael's mentioned non-invasive ventilation, so that is ways of ventilating to providing oxygen support to people where you don't have to put a tube down into the lungs and down into the windpipe to do that. That's invasive or mechanical ventilation. And we are learning all the time, not least through international collaboration, as to how non-invasive ventilation might be used. So the overall strategy is to keep our ventilation capacity and our critical care facilities ahead of the demand. And we have successfully done that so far. And if we all comply with the measures that are put in place, that have been put in place, then that gives us the very best chance that the demand never exceeds the capacity. And one final thing I'd say about capacity. So I think it's important that everybody realises that although we are focusing on increasing capacity to deal with the coronavirus, the NHS is still working as it always does, for people with other health emergencies. So it's really important that at this time when there's a focus on COVID-19, that if you have symptoms of a stroke, that if you have symptoms of a heart attack or any other emergency, that you are contacting the NHS and the health services as normal. Because the NHS is focusing as hard on people with other conditions, other emergency conditions, as it is on coronavirus. And it's important that we do both of those at the same time, and that has been our strategy and will continue to be our strategy.
Thank you very much, Steve. Anything you wanted to follow up on with me, Michael, or...?
Could I just ask quickly whether your introductory remarks about ventilation change the underlying numbers, that is broadly that we have just over 8,000 ventilators and 8,000 on order?
I think it's important to stress that we have more than 8,000 ventilators in the NHS now, and we want to increase capacity well above the 8,000 additional that has been cited. And we want to be in a position where we have the highest level of ventilation capacity possible, which is why We are, as I mentioned earlier, not only producing non-invasive ventilators with the help of UCL and Mercedes-Benz, but also by Penlon Smiths, Diamedica and other companies are also working with us. It's also why we're sourcing ventilation capacity from Germany, from Switzerland, from China and elsewhere. With that, I just want to say thank you to Steve and to all the staff in the NHS, and to say thank you to our colleagues in the media, and there'll be another press briefing, of course, tomorrow. Thank you.